At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Oh My Aching Back on Wednesday, July 16th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Dr. Tom Roselle Live right here on WMAL 105.9. Great to be with you again, and we've got a very interesting program. By the way, thank you for those who came to the class the other night on anxiety and depression and so forth. And Annabeth Goss and Dr. Stephanie Pina were amazing and with their presentation. I hope you learned a lot. And I got to meet a whole lot of people that I hadn't met before. So thank you for coming. Coming up on July the 16th at same old place, Roselle Center for Healing, we're going to do a class on the causes of low back pain or my aching back and what happens and why it doesn't go away and what the problem is. And we're going to start with it just a little bit today. And we're going to get into the weeds about it because, it's the number one cause of disability in the United States. Number one, and it's worldwide. It's just unbelievable. As we get into the live stream program today, I'll tell you a little bit more about it, but I want to just kind of begin to touch on some of the multiple causes of low back pain. It's one of these things that you really have to look at from a structural, that means all the stuff you can put your hands on, neurological system, platform, an injury that occurs to that structural platform, that building called you, and then the biochemical, bioelectrical platform, the things that are outside of our body that we're exposed to that come inside, everything that goes through those lips of yours. And then the third piece is the stress patterns that come about from your decision processing and how you just chew on things and until they destroy you. And the truth of it is that there is a real thing called, emotional low back pain. And so we'll talk about that on the 16th. And, as always, when I get involved, I'm going to do some demonstrations. I'm going to show you things. I'm going to show you what can happen. I'm going to look at you. But low back pain is not just a singular area at the belt line, although that's one of it, but it can be throughout your whole pelvic area. It could be up into the lumbar spine. And then if it gets really irritating, now you got a little bit of nerve distribution, and it can go into your buttocks. It can go down the back of your legs. That's the sciatic distribution. It can go to the front of your legs. That's femoral distribution. But we're going to look at, particularly when I'm dealing with the professor, Dr. Harlan Browning, who I'm going to be co-presenting with on the 16th. He's going to teach you that from the feet up is where we have to look at the structural components. Because if your feet aren't working the way they're supposed to, and it's not just a simple matter of putting a pair of orthotics in there, you have to understand why the feet aren't working. It's not okay, in my opinion, to put orthotics in because now you're putting a cast on something. The feet are viable. They're meant to move. And if they're not moving the way they're supposed to, if the muscles aren't firing the way they're supposed to, there's a reason. Very few people, but some do have an anatomical shortening of the bone matrix. And some authors will tell you virtually 90% of the population has some measurable shortening. Is it enough to cause a problem? No, not really. And then when you're young, and if you have that, your body's in such amazing shape if you're an athlete, right? Particularly if you're, you do any kind of wrestling or martial arts or gymnasts are probably the most together people that I've ever seen. And those muscle patterns are so strong that you don't notice that anatomical shift or that until you do. Ladies, you're wearing up until modern times, I don't know who did it to you, but told you had to wear those silly heels. That shoves your low back into a place of really egregious position. And those nerves that go from the low back not only go into the muscles and the legs, but they go to the organ systems. They go to the uterus. They go to all the organs of reproduction, guys' testicles. And by the way, guys, here's a thought that you need to mess around with in your brain. A lot of times that erectile dysfunction occurs when you stand up or you move. It's because your low back is compromised and the nerve that goes to the scrotum is getting pinched. And so when you move and you pinch it, guess what happens? Goes away. It's not there anymore. So, that's a question that I have for a lot of guys who have the problem. It can be hormonal, absolutely can be hormonal, but also could be structural. It can have a lot of things. How many of us have those paid for, you know, increased girths around the midline? We never had those before back in the day. A lot of it is because of lack of activity. A lot of it is because we don't eat anywhere where we should. A lot of it is exposures to other chemistries. And I'm going to talk about that when you come in on the 16th. We're going to show you, the structural, chemical, emotional platform and how it's causing the problem. But here's the deal. The different types of low back pain are getting, and we've known them all, but multitudinous. If you look it up, you can say something as simple as I work too much in the garden. And, I've got stiff back problems. I got a little muscle spasm. It's tough standing up. It lasts for a couple of days and you get in a hot shower and stretch a little bit and it goes away. Okay, cool. So we know that takes place, but it also can be from overstretching muscles and only doing certain muscles that you like to do. You go to the gym and you do leg extensions on one of the machines or leg curls or back extensions, but we forget about that low belly muscle, the one that really holds everything together. And if we're not working on that properly, we have issues. How about postural patterns? How many, the old days, your mother used to say, and everybody else say, stand up straight. Well, yeah, we forget about that, right? And we're hunched over because we're on a computer. Our computers are never in the right position. We're in lousy chairs and supporting postures, or we're sitting on the sofa and we have a laptop in our pelvic area, which is not a good thing, by the way. And then we look at sports and we look at, the types of bending to one side or twisting actions and so forth. So there's ways of making that a whole lot better. And a lot of it has to do truly with your willingness to change your lifestyle a little bit. We can have trauma, we can have falls, we can have accidents, we have sports injuries that link in. And here's the thing, and I've told everybody this repetitively. When they tell me they have low back pain, I said, when's the very first time you ever remember having any kind of pain? And they look at me, what? Any kind of pain. How far back does it go? And well, when I was young, I took a blow, but it only lasted a couple of days. Well, I'm here to tell you, if it wasn't fixed properly, if your spine wasn't positioned properly at that point, if the muscles weren't rebalanced, that pain is recorded in your neurological system and it continues to bear fruit, meaning pain repetitively over a period of many years. And, so you try to do a little light stretching, you get a little massage, you put an emollient on it, something that's designed to relieve the pain, you're doing all kinds of things, but it never, ever, ever fully resolves itself. Why is that? Well, it's because the alignment of the spine in chiropractic, they call it vertebral subluxation, bones out of position, causing the nerve to be irritated. In osteopathy, it's called a spinal lesion. But it's the same thing. It's causing irritation to the cord or the muscle, and the signaling of it directly to where it's going is being altered exponentially. You can have osteoporosis, that's loss of calcium. And when you have osteoporosis, it can lead to some ugly things like fracture or collapse of the vertebrae. And trust me, that will trigger back pain exponentially. And it could be because you're drinking too much alcohol. Alcohol intake will cause bone loss. And you could be a hormonal deficient human being. Estrogens will or I should say, the lack of estrogens will also continue to produce prolonged pain patterns because it's necessary to help you keep calcium in the bone. And just a little bit of loss of calcium, an osteopenic condition, not osteoporosis, the step before that, osteopenia, will cause the muscles to ache like crazy. So you don't want to drop to the medications because there's all kinds of problems with that. How about good old-fashioned osteoarthritis? And when a patient says, well, I have arthritis, I'll say, which kind of about, 100 and some do you have? They look at me, what? I said, how many different types did your doctor tell you that this might be a possibility of? But osteoarthritis can affect, apparently the statistics, somewhere up to about 33 million people in the United States. That's 10% of the population. And that's when the cartilage in the joint spaces begin to break down, including the ones in your spine. And that's what causes a lot of back pain. Now, the question becomes with osteoarthritis is why? Why is it there? Why me? It can be anything from viral patterns to inflammatory reactions due to bad dietary patterns, injuries that are repetitive and continual, and the gut not having the good microbiome. We're going to go over that on the 16th, and I'm going to show you how you can differentiate where it's coming from. I promise you, you're going to go away with a whole brand new headspace on why spinal alignment is so important, as it affects so many different things. You're going to learn about, the swelling that takes place because of vicious neurological loops that won't shut down, and why your joint spaces are degenerating. And pretty soon you're going to make the house payment on a hip replacement or a knee replacement, or somebody's going to tell you you have to have a artificial disc put in your back. When, by the way, the body is extraordinarily forgiving as long as you are willing to step up and make some changes. I promise you. But procedures such as steroids or cortisone injections may have a small, immediate effect. But in chronic conditions, if you don't eliminate the why is that, the cause of the problem, that just makes it worse. Why? Because steroidal injections cause further degeneration of the joint. There's something called Depomedrol injections. That's when they will inject a steroid-like substance into the disc space to decrease the inflammatory response. In many cases, they'll do one every 2 weeks if the first one gives a little bit of relief and the second one gives a little bit more relief. But they can't do more than that because they know in the literature, it tells you that even though it may mitigate the discomfort, it destroys the joint. So, and then what you're talking about, is disc replacement, joint replacement, and so forth. You can have a herniated disc, they call it slip disc. It can be a bulge, it could be a little fragment, it can be a lot of things. But believe it or not, when we see herniations on x-rays, on CAT scans, on MRIs, it's not absolute, this is what's causing the pain. It's the end product of something being neglected over a period of time. That disc, that shock absorber in between the two bones, the outside is hard, like chicken cartilage. The inside is like toothpaste. It's a jelly-like substance. And when the outer layer begins to crack because of abnormal position of the bones that it's between, pretty soon it will slip through and it causes pressure on something called the thecal sac. What does that mean? That's the covering of the spinal cord. And depends on where it's being pushed or the nerve that it entraps, then you got a problem. So, you can have wear and tear that's caused it. You can have traumatic injury. Back in the day, there's been a lot of athletes who are in great shape that do a quick rotational move and they herniate it. But those are the rare things. Those are the things that take place. But I'm here to tell you that there are things that can be done to resolve it. We talk about fibromyalgia, and I think it's a way, way, way overused terminology. It affects, 4 to 5 million people in good old USA. Can it cause back pain? Yes, it can cause back pain, but it can cause fibromyalgia is not just back pain. Fibromyalgia is 4-quadrant pain. That means you got pain virtually all over your body and it just never goes away. And it has to be there for at least 3 months. And this goes back, to the College of Rheumatology that came up with the descriptive patterns back in I think it goes back to 1989, 87, something in that neighborhood. The stenotic patterns. So you heard spinal stenosis. Uh, that's a narrowing of where the nerve comes out. It's damage, inflammatory reactions, scar tissue, calcification. And there's ways of dealing with that. And then you can have the more egregious stuff where you're getting into, bone lesions, multiple myeloma, but that's rare. That's, when it comes to back pain, that's not something that is, that's the zebra in the family. So when you're looking at any kind of pain, make sure that you're looking at the horse, not the zebra. Okay. So when you hear hoofbeats, look for the thing that's most common. That you've heard me say that repetitively. You can have spinal deformities, and we'll talk about that. And those things are either increased curvatures or loss of certain curvatures or curvatures we call scoliosis. We have vertebrae that move excessively. It's called a spondylosis or spondylolisthesis. And we're going to tell you about those things and how to actually reform certain pieces of damage within your body. But more importantly, wouldn't it be nice to get out of pain? Well, on the 16th, we're going to show you how to do that. We're going to demonstrate to you. We're going to show it to you. We're going to walk you through the process. We're going to make it a very productive night for you, because even, if you don't do anything with us about it, my job is to give you tools that you can help yourself with. How many of you sit all day long and don't even get up and walk around? How many of you, stand up from a chair and you've got to stand there for a minute because your back feels like somebody's got a vice grip on it, and then it begins to relax and go away. There's a lot of muscle inactivity because it can't work. Why? Because you don't have enough mineralization. One of the most common is magnesium. The other one is calcium. Oh my God, my doctor told me not to take calcium. Well, your doctor and I can have a conversation, because that's not the case. You have to have calcium in your that you have to have on a daily basis, but you got to have the transport systems. You got to be able to absorb it. You have to have hydrochloric acid to break it down in the stomach so it can go someplace else. You have to have enough magnesium and K2 and so forth, and vitamin D. And then guess what? All of a sudden you begin to see reformation. We have patients who come in with severe osteoporosis, and their doctor says you've got to take the bisphosphonates, which are the things that keep the calcium in the bone. Well, it keeps dead calcium in the bone. These are called osteoclasts, things that destroy the bone matrix. And that's not the way you do it. You can actually restore it. We have case after case after case that once we've started treatment, they begin to reverse, and we have documentation. We see the bone studies, we see the MRIs and so forth, the CAT scans, and guess what? They can turn around. So don't buy into the framework that you're stuck with this for the rest of your life and why me. But you have to understand that it's multidimensional, and you have to get motion back in. You got to get function back in for any type of resolution, and you have to fix the chemistry. You have to make sure you get a little activity. Those are all critical. The body's an amazing thing. It will reverse itself. My children, my grandchildren, have had structural chiropractic care since they were born. And it's not just for an ache or pain, it's for optimization of the body's immunological responses that allow calcium to move the way it's supposed to allow inflammatory levels to die down, to keep up immunological responses. Here's another thing. Some back pain comes and goes quickly. Other times, when it's there, it's kind of a nagging, constant thing, and say, well, if I take this, I'll feel good. But here's the other piece. Here's something that I want you to keep your eye on. You had back pain, but now you have pain in your leg or your foot. You had back pain, but now you have numbness or weakness that shoot down your legs. You had back pain, but you keep setting yourself up for more injury because you don't have any strength. You had back pain that doesn't come and go anymore. Now it's constant. You have back pain, and all of a sudden you have bladder or bowel incontinence. Wouldn't it be nice to fix those things? Well, I'm telling you, it's possible. And I'm going to tell you a little story. And when I was an intern, there was a truck driver that came in. And this guy, as an intern, we inherited from other guys, and he was a long haul truck driver. And he had always this low back pain and this pain that radiated down both legs, but particularly on one side, on the right side. And in those days I had time. So I was standing there while he was putting his pants back on, and he had this wallet literally that was probably the better part of 2.5 inches thick, right? And he put it in his back pocket. And every time he got done in the clinic, he felt better. But he'd come back and he was always in bad pain. I said, hey, let me ask you a question. I said, do you have that in your pocket and when you're in the truck? And he laughed. He says, yeah, that's my filing cabinet. I got everything that I need. I said, okay, you got to make me a promise. He looks at me strangely. He said, what? I said, when you get into the truck or you sit down anywhere, take the wallet out and either put it in your front pocket or put it in the cab next to you so you can grab it when you need it and so forth. I said, will you do that for me? And he just looked at me. I said, come on, just humor me. And he said, okay. And so I saw him about 4 days later. He comes back into the clinic and he said, and he's holding his wallet. He said, are you telling me this is why I haven't been able to get rid of this pain in years? I said, yeah. He said, when I saw you put that in your pants in your back pocket, and I know that you sit for hours and hours in long haul, that's a distortion. That's like putting a wedge, putting a shimmy in something. You're jacking that side up and it's causing compression and irritation. How many of you sit in a partially distorted pattern? How many of you cross your legs and sit that way for hours on end? You're torquing your pelvis. How many of you, are wearing shoes that they're cute, but they're going to distort your spine and your feet hurt? Trust me, if your feet hurt in your shoes, the rest of your body's taking a beating as well. How many of you put orthotics in, and the only way that you can walk is if you put the orthotics in, but if you go too long without it, the back pain begins to reoccur. I'm telling you that you can resolve this, but you have to know how to resolve it based on what was the triggering mechanism that took place to begin with. Okay, so we want to look through the whole puzzle. We're going to do that on the 16th, and we're going to talk a little bit more as we go through. We'll talk a little bit about emotional back pain as well, which is kind of an interesting pattern. A lot of us are in that situation. You ever think why you go away on vacation? I mean, if you really go on vacation where you shut down and do nothing, you sit in a cabin overlooking the mountains, you go to a beach and you're looking at the water, you just get away and you feel a whole lot better, and all of a sudden you're not in pain anymore. I would encourage you to think that there may be a stress-related situation that goes along with that. If that's the case, we got to change our lifestyle just a little bit. Do you know the most productive CEOs, the most wealthy people in the world are the ones that take breaks throughout the week and they do nothing. They get away because they know that their mind is clearer, works better, and they relax more and their body lets go when they're not doing that. They've learned that. So why are the rest of us going crazy and we're playing this silly game of push, 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 push with no break in between? I would encourage you to take a look. We're coming up to that place right now where we're going to go to the live stream and we're going to get into this a little bit more. We're going to talk a little bit more about your back pain and what you can do about it. But remember, circle it right now. Actually, what I'd like you to do is just register right now. Go to drtomroselle.com, drtomroselle.com, or rosellecare.com, and register for our in-house class with the professor, Dr. Harlan Browning, on the 16th of July coming up. We're in summer already, my friends, and I promise you it's going to be a great night. So remember, we're going to continue the process. The journey is an ongoing one, and I'm here every Sunday for one reason only. You deserve the data, you deserve the information, but more importantly, I do love you all. Have a great Sunday. Let's go to the live stream now.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Oh My Aching Back on Wednesday, July 16th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.